Nicotine is actually a naturally occurring compound. And if you think of the special taste and flavor of grapefruit, it's basically a nicotine. It's been used widely in fragrance industry and food industry. It's rather effective as an insect repellent. It works against ticks, it works against mosquitoes, and you can compound it with soups, with lotions, with cream. It is a more appealing option as an anti-repellent compared to more conventional options like DEET, for example. People may get the classical target or bullseye rash. We also call it erythema migrans. And if people get treated, that usually goes in, the infection would resolve and will not have any long-term consequences. Some patients may go into, if they go untreated, the infection will evolve into the chronic phase that you mentioned earlier, where the bacteria can have access to heart, causing heart block, or to the joint, causing a lot of joint pain and inflammation, usually involving the knees or the ankles. And on rare occasions, it can go to the brain and nerves, causing facial droop. And sometimes they even present as acute inflammation of the brain, covering calling meningitis, but this will be a very severe form of the disease. The diagnosis of Lyme disease is going to go into three major categories. A, do you live in a place or have you been in a place where you could be in encounter with a tick that carries Lyme? So in the United States, that's usually the northeastern states and the Midwestern areas, upper Midwest area like Minnesota, Wisconsin area. So do you live there or have you been there? So if you live there and you have been there, the next step in diagnosis, do you have symptoms, clinical symptoms compatible with Lyme disease? Again, if you have pneumonia, we're not going to think of Lyme disease as a cause of your symptoms. But if you're having the classical skin rash or the facial droop in the right time of the year where the ticks are active, like during summer month, then that increases our suspicion for Lyme as an etiology for the patient's symptoms. And then we confirm the suspicion by doing specialized tests. And the most commonly test we perform is an antibody test that basically detect the immune response of the patient to that particular bacteria, the Lyme bacteria. And most of these antibodies comes in two-step testing. So there is an initial screening test. If that's positive, we confirm it by another testing method. And the current testing techniques with serology are fairly sensitive and specific, especially with the new two-tier testing that the CDC recommends. If you think you have Lyme disease, please consult a specialist in infectious diseases or talk to your primary care doctor. And one thing you should never do is keep taking antibiotics for months and months for this chronic Lyme disease. Because as of today, we don't have any evidence that prolonged treatment will help patients, for example. And as an infectious disease specialist, I see a lot of patients who, given that diagnosis, who were on antibiotics for months without any benefit, and often a more serious diagnosis was missed. If you find a tick and you're not sure how long has it been on your skin, it's very important to talk to your doctor. If you're able to find that tick and identify it as one of the Lyme-carrying ticks and it's engorged, which means that it's likely been in the skin for more than 48 hours, we could actually provide medication to prevent the development of Lyme disease. And that's usually a one-time dose of a medication called doxycycline.